Today, we're diving into hernia repair, also known as hernioplasty. Now, if you're a nurse in a med-surg setting, this is a procedure you'll see all the time. And we're going to cover exactly what you need to know to take great care of these patients. So we're going to follow the entire patient journey. We'll start by making sure we really understand what a hernia is. Then we'll get into when surgery actually becomes necessary. From there, we'll look at the different repair options, and we'll wrap up with our critical role as nurses both before and after the operation. All right, let's start with the basics. The medical term for this procedure is hernioplasty. And it's a great name because it tells you exactly what's happening. It comes from hernio, for hernia, and a Greek word, raphe, which means seam or suture. So it literally means suturing a hernia. So what exactly is a hernia? Well, to put it simply, it's what happens when an organ or even just a piece of tissue finds a weak spot in the muscle wall that's supposed to hold it in and pushes through. And these can happen in a few different places. The most common types that you're going to see are inguinal hernias, which are down in the groin area, umbilical hernias, right around the belly button, epigastric hernias, which are just above it, and incisional hernias, which can pop up through the scar from a previous surgery. So what causes these weak spots to form in the first place? Well, the key risk factors are pretty much anything that increases the pressure inside the abdomen. So think about things like obesity, having a chronic cough, pregnancy, or even just frequent heavy lifting. And as we just mentioned, previous surgeries are also a big one. Now, not every hernia needs to be operated on right away, but you definitely can't just ignore them. Surgery becomes the plan when they start to cause significant pain, or worse, when they lead to potentially life-threatening complications like an obstruction. So knowing when to act is absolutely crucial. Surgical repair is definitely recommended if the hernia is getting bigger or becomes painful. But the really big risks that we're watching for are incarceration, that's when the tissue gets trapped and can't be pushed back in, or the worst-case scenario, strangulation. And this is what makes a strangulated hernia so incredibly dangerous. The blood supply to that trapped tissue gets completely cut off. When that happens, it is a true surgical emergency, and time is critical. This brings us to the surgery itself, the hernioplasty. The basic idea is pretty straightforward. The surgeon makes an incision, gently pushes that bulging tissue back where it belongs, and then reinforces that weak spot in the wall, usually with some sutures or a synthetic mesh. This can be done under either local or general anesthesia, and there are two main ways to approach it. First, there's the traditional open surgery with one main incision. The other way is laparoscopic, which uses a few tiny incisions, a camera, and some very specialized instruments to do the repair. That mesh reinforcement is really a game changer in modern hernia repair because it seriously reduces the risk of the hernia coming back. And this brings up a good distinction in terms when mesh is used, the procedure is often called a hernioplasty. It helps distinguish it from a simple suture repair, the hernioplasty. Okay, now let's get into the practical side of things. Our role as nurses in getting a patient ready for hernia surgery is absolutely critical for a safe and successful outcome. Think of this as your essential pre-op checklist. You've got to confirm the patient's NPO status and get that IV access going. You'll handle any site prep, like cleaning the surgical area if it's needed, and crucially, you're going to provide that patient education about the procedure, what to expect with anesthesia, and the post-op plan. And finally, always verify that a signed informed consent form is in the chart. So once the patient is out of surgery and in recovery, our focus shifts completely to post-operative care. Our goal now is to help them recover smoothly and, just as important, to prevent any common complications. In that immediate post-op period, your priorities are really clear. You're on top of pain management, assessing their pain and giving meds. You're doing wound care, watching that incision for any bleeding or swelling. Getting them up and walking early is so important to prevent DVTs. You're also going to monitor for urinary retention, which can be a real issue after inguinal repairs. And all the while, you're reinforcing all that important patient teaching. And now for that last crucial step, discharge education. The patient has to understand these key things before they go home. Absolutely no heavy lifting for 4 to 6 weeks. They need to keep the site clean and dry. Make sure they know the signs of infection to watch for, like a fever or any drainage. Stress how important that follow-up appointment is. And give them this great practical tip. Show them how to support their incision with a pillow whenever they cough or sneeze. Ultimately, we as nurses are the ones who guide the patient through this entire surgical journey.
When we have a solid understanding of the procedure and we combine that with thorough patient education, we are setting them up for a much safer and much more successful recovery.
If you found this guide helpful, please give it a like and subscribe for more content just like this. And don't forget to hit that notification bell so you can stay updated.